Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday at East Cooper Medical Center, and today we're sitting down with a Lowcountry urologist to get the facts about prostate cancer, which, according to the American Cancer Society, is the second leading cause of cancer death in men.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Stephanie Seixas-Mickelas. She is a urologist here at East Cooper Medical Center. Thanks for joining us.
Thank you for having me.
All right, we're talking about prostate cancer. All right, and first off, for those at home who don't know what prostate cancer even is, what is prostate cancer?
So essentially, prostate cancer is a malignancy or a cancer in the prostate gland. So the prostate gland is part of the male reproductive system, okay? It basically contributes to the seminal fluid that helps transport and nourish the sperm.
Okay, so how are these things, how is prostate cancer diagnosed?
So that typically entails a blood test called PSA, or prostate specific antigen, as well as that's used in conjunction with a rectal exam to examine the prostate to feel for any nodularity, anything that suggests a possible prostate cancer.
So when do men typically start getting tested for this, or having that unpleasant experience with the doctor?
You know, every person is different. Every man is different. If there's a family history of prostate cancer, okay, you're going to start screening the gentleman much earlier, usually at the age of 40. So if there's a family history, if they're African American, if there's any exposure to Agent Orange, okay, during Vietnam War, okay. But the NCCN guidelines, or the National Comprehensive Cancer Network guidelines, okay, recommends screening beginning at the age of 45.
Oh, wow.
Okay. And then potentially carrying that through until the gentleman is age 70, 75.
Okay, are you seeing, with your experience, any changes as far as younger people being diagnosed with it, or any trends in that regard?
I think patients are just becoming more aware of what prostate screening is and then the benefits, okay? So prostate cancer, unfortunately, there are no early signs, and so the
you
disease,
have no symptoms or anything?
Exactly.
Yeah,
so
okay.
in the early stages, it's clinically what we call silent, or no symptoms, right? Sometimes patients can present with a change in urination, some blood in the urine, semen, back pain, but because it tends to be clinically silent, that's the importance of having prostate screening.
So is it kind of like cervical cancer in a way? Like how that can,
It could be clinically silent, absolutely.
Okay, and then until you go in there for your yearly exam, you don't really know?
Exactly.
Unless you have outside signs.
Once it's a much advanced stage, then yes, then men do present with symptoms.
As far as like it being preventable though, it's super preventable, correct?
It is. I mean, and that's why it's a simple blood test and an exam annually by either your primary care or your urologist.
So, but when we were just saying that it's silent, as far as it being preventable, I think sometimes maybe there's like a conflict right there, because you're thinking it's silent and it's preventable. What if you don't catch it early? That's probably why you have to know your family history, right?
You should know your family history and things like that. And prostate cancer in general, when it tends to be a very slow growing process, but there are aggressive forms, okay? And so when a man is diagnosed with prostate cancer, it's his urologist, his medical team that's kind of going to formulate an individual treatment plan. And there's various treatments for prostate cancer, okay? And it can vary from a wait and watch approach, or what we call active surveillance, to more aggressive therapies, medical and surgical.
Like, you go in there and cut it out.
Removing the prostate, having radiation, requiring hormone therapy. So there's a lot of, it all depends on the type of prostate cancer, and obviously also the overall health of the man.
So bottom line is, ladies, get your men in here, right?
Exactly.
So come get their yearly,
once a year, just a blood test, and it does entail again the rectal exam, but again, I think there's more anxiety going into the exam than coming out.
But I mean, we have to do it every year.
Exactly. Us ladies, we have to do it.
The men have to kind of get over it. All right.
Exactly.
Thank you so much for joining us, and for more information, you can head online to eastcoopermedctr.com.